अस्सलाम वालेकुम जी। आज हम नेक्स्ट 15 MCQs करेंगे। पहले हमने 15 MCQs किए थे, आज हम 16 से लेकर 30 MCQs करेंगे। 16 MCQs है कि an unstable patient presented in emergency with multiple rib fracture. On examination, trachea shifted to left, reduced breath sound, hyperresonant percussion, decreased fremitus. On the ipsilateral side, how will you treat this? तो ये न्यूमोथोरैक्स का पेशेंट है, तो इसमें ट्रैकेस्टोमी करेंगे, चेस्ट ट्यूब इंटुबेशन करेंगे, नीडल थोरैक्टोमी करेंगे, बोथ बी एंड सी। तो ऑप्शन इसका डी ठीक है कि आप चेस्ट ट्यूब इंटुबेशन और नीडल थोरैक्टोमी करेंगे। 17 MCQ है कि आप बेबी आफ्टर ईटिंग develops shortness of breath due to which type hypersensitivity reaction। so इसका type 1 है। 18 है कि 40-year-old man comes to the physician because of 6-week history of increasing shortness of breath, fatigue, and fever. He has had a cough productive of foul smelling sputum for 4 weeks. Examination of the chest shows dullness to percussion over the right lung cavity, right upper lung field. An X-ray of the chest shows a lung cavity with an air fluid level and surrounding infiltrating the right upper lobe of the lung. What is your diagnosis? So, is option A correct? Lung abscess. 19 MCQ है कि a 20-year-old man comes to the physician because of recurrent episodes of shortness of breath and a non-productive cough for the past 4 months. He has 2 episodes per week, which resolve spontaneously with rest. Twice a month, he wakes up at night with shortness of breath. His pulse is 73 per minute. Respiration are 13 per minute, and blood pressure is 122 per 70 mmHg. Pulse oximetry on room air shows an oxygen saturation of 98%. Physical examination shows no abnormalities. Spirometry shows an FVC of 95% and FEV1 ratio, FVC ratio of 0.85. So ये restrictive lung disease का होगा, and an FEV1 of 81% of predicted. What's your diagnosis? So either option B correct है, asthma, जिसे हम उर्दू में दमा कहते हैं। Which of the following is the treatment of choice for acute asthma? Corticosteroid, short-acting beta-2 agonist, magnesium sulfate, short-acting muscarinic antagonist. So option D is correct for acute asthma. 21. A 42-year-old man present with worsening dry cough accompanied by fatigue, fever, and malaise. Physical exam is remarkable for an erythematous, non-ulcerated, and tender nodule over the bilateral shins. Chest radiograph shows bilateral hilar adenopathy and non-caseating granuloma were found in lungs on biopsy, most likely cause. So, is option A correct है, sarcoidosis, क्योंकि जो कैविएटिंग का ग्रेनुलोमा होता है वो इन्फेक्शियस डिजीज के अंदर होता है, जिसमें इन्फेक्शन हो, और नॉन कैविएटिंग ग्रेनुलोमा उसमें होता है जो इन्फेक्शन के बगैर हो। तो ये की पॉइंट था। 22. 20-year-old male has dyspnea on his lying on. The structure most likely to cause this is inguinal lymph node, multinodular goiter, puberty goiter, retrosternal goiter. तो इसका ऑप्शन डी है, retrosternal goiter. 23. 30-year-old male suffering from bronchial asthma underwent lung function test. Which of the following parameter confirm the diagnosis? So 23 का option beta ठीक है, FEV1 over FVC less than 65%. 24. A 50-year-old male complains of breathlessness on exertion. On examination, there are bilateral basal cleft and S3 is inaudible. His BP is 110 over 80 mmHg and pulse is 70 per minute. What is the most suitable treatment? So इसमें हम diuretics and ACE inhibitor देंगे, क्योंकि heart failure में management in this case bilateral basal cleft suggests excessive fluid in the lung. For this we need to add diuretic for excessive fluid with ACE inhibitor to decrease afternoon preload to prevent heart failure. 25 is 2 to 3 anti-tuberculosis drugs are used together for the treatment of pulmonary tuberculosis because if only one drug is used, it will increase them. So इसमें बीटा ऑप्शन ठीक है, the emergence of resistant microorganism resistance इख्तियार कर देगा। 26 है कि concerning tuberculosis, a patient who returns sputum positive after having left treatment for at least 2 months is called new case, return after default, relapse, failure case. So इसमें ऑप्शन correct है बीटा, return after default. 27 है, a 15-year-old boy presented with fever, malaise, cough, and rash. He was diagnosed as having malaise. Which of the following is the most frequent immediate complication of this condition? Arthritis, infertility, pancreatitis, pneumonia. So option इसमें D correct है, pneumonia. 28 है, recently a 10-year-old girl had an episode of upper respiratory tract infection. She presented with a fever of 100 Fahrenheit for 5 days and pain in the right lower abdomen for 2 days. The patient was anemic with enlarged tender cervical lymph node and periumbilical tenderness. The most likely diagnosis is acute appendicitis, mesenteric lymphadenitis, typhoid fever, worm infestation. So option B इसमें ठीक है, mesenteric lymphadenitis. 29 है कि a young labrador while carrying the load developed sudden severe breathlessness accompanied by right-sided chest pain of moderate intensity. His pulse is 90 per minute, BP 130 over 80 mm, heart sound normal, and JVP is not real. Which is the most likely diagnosis? Acute myocardial infarction, asthma, angina pectoris, pneumothorax. So इसमें option D ठीक है, pneumothorax. 30 है कि a 20-year-old female complained of dry cough for 1 year. On many occasions it had her awake at night. She had no breathlessness or other significant symptoms. A weak sounding audible. She is non-smoker. There's no history of weight loss. What is the diagnosis? So इसका ऑप्शन ठीक है, अल्फा ब्रोंकियल एसेमा. सो आज के लिए इतना ही, फिर मिलते हैं इंशाल्लाह नेक्स्ट वीडियो में. थैंक यू सो मच.